So my hair loss journey has been an interesting one. It runs in my family, my father's side, everybody has had baldness.
There's a genetic history, yeah.
I had heard about minoxidil helping in hair growth. I applied it I think for a month or so, and funnily my hair loss increased.
That actually happens with a lot of them. So there are a few patients who start this over the counter and maybe they don't know when to start and when to stop, and that could kind of sometimes backfire.
In a few places, the person who does it is not a doctor, but they are.
The technician.
There was always this nervousness and fear of what if it goes wrong.
Yeah.
I think the biggest factor though is to research and then to take the actual step. To be honest, for me, it's obviously the name and the clinic, but it's the doctor who does it. I was told about what is going to happen in every session. There were details given to me, so there were no surprises and shocks. That's the most important thing as to how you set expectations of your customer. Basically.
A lot of people have a lot of fear for pain.
Don't come in with this expectation, oh, it will be completely painless.
What is the difference that you feel maybe when you get up in the morning every day, when you see in the mirror?
Now I can style them, I can grow them, cut them in any which way. So I think that's the fun aspect that I was missing, which has come back. Don't become sad, depressed because you don't have hair. That doesn't mean that you don't look for options for a hair transplant. It's been an emotional journey, but the outcome has been really good.
Hi Tejas sir, welcome on Beyond the Mirror.
Hi.
Thank you so much for being here with us.
Thank you so much for calling me.
So we've had great interactions with most of our guests. Of course, they've all shared their hair restoration journey with us.
Yeah.
How in the initial stage, when they started experiencing the hair loss, how to an extent for few people it did impact the overall confidence, and then how did they seek for different treatments, and how then they eventually decided to go for a hair transplant, followed by personally, professionally, how that really impacted the overall confidence. So it's been great talking to almost all the guests. Mm-hmm. With you, it's very special. I believe you're here in Dubai for last 10 years.
Yeah, originally from India in Delhi, but stepped out of India a long time back and in Dubai for the last 10 odd years. Yeah.
Okay, right. So before we get into the, dive into the conversation of your hair journey and all of that, first we would want to know a little about you. If you could just, share with us how's your overall life in Dubai from the work perspective, professionally, what do you do?
So I'll start off with where I was born, obviously. Born
okay,
in,
yes.
India, stayed there for almost 26, 27 years.
Right.
My schooling, college,
right.
everything there. Started my professional journey. Correct. And then in 2007, I went to UK for my studies.
Okay.
And since 2007, I've been outside of India.
Okay.
And about 20 years of work experience, and
right.
most of it in financial services banks.
Correct.
In the middle, I had my own startup. So that went well. But now I'm back to the corporate life.
Right.
So all in all, nothing to complain about. It's been a good life. Stressful, as all of us have in our lives. But so far, so good.
Talking about, of course, now the hair loss journey. So when did you identify that, you've started facing the hair fall or the initial hair thinning? At what age did you start experiencing that?
So my hair loss journey has been an interesting one. It runs in my family, my father's side, everybody has had baldness.
There's a genetic history, yeah.
For me, I think the hair loss started in the late 20s, mid 30s, and it really increased by my early 40s.
Right.
So whilst in the earlier days I was fine, but by the latter part of the 30s, I started getting a bit worried.
Right.
What did I do about it? I had heard about minoxidil helping in hair growth.
Right.
Although I didn't consult any doctor. I applied it, I think, for a month or so.
Okay.
And funnily, my hair loss increased. So I got a bit stressed and I left it in between. So I don't know.
I think that actually happens with a lot of them. So obviously, firstly, like we always say, which we've also discussed with you, going to a dermat and getting the right counseling that's so important.
That's correct.
Because there are a few patients who start this over the counter and maybe they don't know when to start and when to stop, and that could kind of sometimes backfire. With minoxidil, your experience is something which most people have had because it's a vasodilator, as we know. So it pumps up the blood circulation, but initially you see an aggressive hair fall because it it accelerates your entire hair growth cycle, followed by which then it stabilizes. Okay. But since you left in a month's time, so obviously then you don't really see much of benefits with that. And it is something which you have to continue really long.
Yeah.
So if you just do it for a month or two, with most patients we see they are not very regular with it,
Correct.
then it doesn't really help. And of course, again, it doesn't help to regrow new hair. It can only help to delay the process of the existing hair, like when it's going into further thinning, it can help in retention. But again, if already the bald patches have been created, then it doesn't help in reversing those damages.
Got it. And so I did that, and ultimately then I stuck to a bald look. I used to shave my head very thin, because having a mop of hair with bald patches is worse off than perhaps shaving it all away.
Yeah.
And to be very honest, when it came to hair transplant, I started thinking about it only, say, in the last 3-4 years. So that was my whole journey till coming to
very rightly you mentioned, because there are a lot of patients who tell us that, they camouflage it in a certain way, either the increase in length, to kind of cover up the areas where the hair growth is sparse. But yeah, this is also a choice where you can completely trim it off so it looks more like a bald look. That's something which, So a transplant, you started your research when, and when did you what exactly were you looking for? What were your expectations? And when did you conclude that, okay, this is the right place for me to, take up the procedure?
Probably for 2-3 years before actually getting it done. And again, research was through YouTube videos. That was my main source.
Correct.
I didn't know many people. In fact, no one who had got a transplant.
Okay, not in your office or in your circle. Okay.
So that was an interesting one. But I used to keep going through these YouTube videos.
Yeah.
See, in terms of expectations, there was always this nervousness and fear of what if it goes wrong?
Yeah.
Because there are so much content out there where they show that it's not been done well and it's irreversible. So that perhaps kept me from jumping into it immediately.
Correct.
But my research was all internet-based.
Yeah. But that's good. I think, in fact, we guide most of the patients that, don't take a hasty decision. You have to plan this very mindfully, and enough research is important, because unless maybe 1 year, 2 year, based on visiting few clinics or going to the right qualified dermats, or even online now everything is available, so people do research on that. So that helps you take a very correct decision, because here a lot of damages, as we know, are not reversible.
Yes.
And we have seen aesthetically, when the transplants don't go right, like you rightly said, that kept that anxiousness within you. Maybe sometimes the hairline doesn't go right, or maybe the donor gets a little patchy.
Yes.
So I think when you have enough research, when you researched well, definitely it makes it easy for you to take the right decision.
I think the biggest factor though is to research and then to take the actual step. You have to really push yourself to actually get it done.
Right.
So that took me a while, but I ultimately.
So you didn't visit any clinics? Online research, of course,
no,
you did.
I visited a couple of clinics. Ask them all the questions.
Yes.
It's funny that I didn't visit Assure before actually getting it done with Assure. Which is an interesting story, because I finally got referred to by a very good friend of mine.
Okay.
Who had got it done in Bombay.
And I think that's with most of us. We have most of, the word of mouth that really builds that confidence, because you've seen somebody already taking a service and seen the results, makes it a little more comfortable for us to then
actually
take a decision.
The key factor.
Yeah.
No matter how much desktop research you might do, you have to actually see an individual with your own eyes to then get that.
Right.
Yeah.
So your friend got it done in Mumbai, but I believe because you live in Dubai, so you chose to get it done here.
Yes. I mean, I was first thinking of whether should I get it done in Mumbai.
Right.
But then I think in terms of convenience, being here,
absolutely wrong.
Going back home and resting after the transplant versus being in Bombay, I think.
Right, of course, right. Yeah. So tell us, how did it all start? Like, you came in for a consultation. Obviously, everything was step by step explained to you. Were you confident in your first visit here, or you still took a time to, get fully convinced about it?
So yes, I came in and I obviously met with the consultant. She took me through various details of what Assure does. Obviously, they looked at my scalp and my hair density. And then they told me the number of grafts that would be transplanted.
Yeah.
And that was my first biggest surprise, because Assure told me that I had the potential of having more graft versus what the other clinics told me. So initially I was like, why is that? What does Assure do differently that the other clinics don't? So I kept asking again and again, are you sure? Are you sure that I can get this number of grafts
Number of
done?
grafts.
So I think the first thing that came across was the confidence in Ashore and the consultant that yes, we can do it. So yeah, I think the first couple of consultations and the visits were very good. I took my time.
Yeah.
I came here 2-3 times and made sure that everything is in place. But yeah, everything was told to me in very good
Yeah.
detail. And I was comfortable then to take this.
Right.
Yeah.
In fact, because you mentioned about the number of grafts, I think that's the query almost all the patients have, because when they've heard a certain number of grafts and when we almost talk about higher numbers,
Yes.
the first worry is, are you sure my donor has that much hair?
Yeah.
But yeah, I'm sure now that the hair has grown, we understand why those numbers are required. Because when you go for lesser number of grafts, we know that overall the scalp does get camouflaged, but the kind of density that we were aiming at, especially when somebody's young like you, so people who are in 30s and 40s age group,
Yeah.
they are looking at a higher density, they are looking at a fuller coverage,
Right.
and we don't want to leave any areas which are patchy. So
Exactly.
that is why the doctors would want to, go for higher graft harvesting, of course, without impacting the donor area. So yeah, I think that's the common question and a worry most patients do have before they get into the process.
But I was explained about it in a very nice way
Yeah.
as to why in her more graft. So
Yeah.
all about the needle size and
the micro
and the
punches,
technique, etc., which allows for a higher number of grafts.
Right. Yeah, because we know that it doesn't regrow again back. So that's the main worry people have.
Yeah.
Right. So when you probably then decided, obviously, to get into the procedure, most patients are then hesitant to shave off the head because they know they have to get back to work and they're not okay with that look professionally. So how did you deal with that?
See, that's where I come back to my comment about I had already done a bald look for the last 5 years.
Yes.
So when I came in and I was asked to obviously shave off my head, I was pretty comfortable actually.
Right,
because I was
right.
maintaining that look. So personally speaking, for me, it didn't matter much about shaving my head off.
Right. And how many sessions did it, how was it divided and how much time did you have to invest? Because that's another challenge.
Yeah, so that was an interesting one. The Ashore way is where you come for shorter sittings every day, but you have larger number of sittings.
Yes.
And again, that was explained to me really well because a lot of other service providers do it in a day.
Yes.
Right. And this is what I was also expecting. How did I deal with it? Actually, the more sessions you do, obviously every day you come in, you have to do the prep and you have to go through the process, which can be interesting. But I think I see the benefit of it now. How did I manage it? It was a problem scheduling from office and taking a few days off.
Right.
But I told myself that, you're getting this done once in a lifetime.
Yes.
So you have to give this much importance to it, right?
Right.
So it was difficult in terms of doing it over 6-7 days, but I understood why we were doing it.
Right. And I believe you split it in 2 phases, right?
Yeah.
It was across the month.
Yeah. So I obviously had frontal and the crown area. And what the doctor told me was it's better to give a gap between the 2 phases.
Right.
Because once you do it in the frontal area, it should be given some time to kind of stabilize. And he said that he would then look at it after a month and then go after the crown area. That's why we divided.
So we went slow and steady with the process, right? And a lot of people have a lot of fear for pain. Like, how was your experience in terms of pain? Of course, you can be honest.
Yeah.
Whatever the discomforts you had.
So personally, I have a high threshold for pain, but it was, I would not say it was very painful, but there is pain.
Right.
I want to be candid and honest because you have, the anesthesia going in and then obviously the transplant happening. And the fact that it happens for 6 days, you come every day and then you have to go through the procedure. So I would call it a low to medium level of pain.
Right.
But overall, it was fine.
Bearable. Of course, with the antibiotics and painkillers that you take, that takes care.
Yeah.
And how long would your sessions usually last each day when you would come?
Not more than 3 to 4 hours.
Okay. So I think that makes it not very painful.
Yeah.
3 to 4 hours.
I was surprised with how quickly it recovered after the session, right? because I'd heard that the pain lingers on.
Yeah.
For me, it didn't linger on for quite a while.
Yeah, so I think that's the beauty of it, because we're doing it into split sessions. So what happens is that area doesn't get very sensitive and
Yeah.
it doesn't get very tender, and we don't even reuse that area again.
Correct.
Because you divide this segment wise.
Yes.
So obviously overall recovery is faster, and with the micro punches that we use, the healing is faster. So yeah, I think at least the later downtime is not as much.
But my only message to everyone is you should come in with the right expectations. The biggest thing about hair transplant is you should set your expectations, right? My first expectation was, okay, after transplant, you can never go back to your 20s natural look, right? It'll become good, it'll become full, but you have to make sure, tell yourself that it is a transplant.
Right.
It'll become as natural as possible,
Right.
Which is the case, as you can see with me. It's great. And the second expectation that I told myself is there will be some pain. Don't come in with this expectation, or it will be completely
zero.
painless.
Right.
So I think those are the
Right.
two key things that I
Which
told
is very
myself.
important, yes, for people to know, because as you rightly said, people come with an expectation, oh, it will be a painless procedure. There are a lot of marketing gimmicks we see around
Correct.
claiming, oh, it's a painless procedure. It is minimally invasive, so there is going to be some amount of discomfort.
Exactly.
But if done slowly, systematically, of course, if you're in professional hands,
Yes.
and everybody is, like you said, the threshold is not same. But yeah, I think if it's divided into sessions, it becomes easy overall from the recovery
I was very
perspective as
managed.
well.
I was
Yeah.
very comfortable. And I think, again, another important factor about Assure is I was told about what is going to happen in every
Yeah.
session. There were details given to me. So there were no surprises and shocks.
Yeah.
That's the most important thing
Which
as
is
to how you
important.
set expectations of your
Right.
customer, basically.
So 3 to 4 hours used to be a procedure. Post that, what all activities did you manage to do after stepping out after the procedure on the same day?
So I was very careful. I had given myself almost 2 weeks block
Right.
that I will not go to office and I will give it the requisite time to heal. So after the procedure, every day I used to go back and sit indoors. I did not step out for almost 10 days to about 12 days, so that no dust goes in, no sweat comes through. So it was more of sitting at home, binging on Netflix, and just chilling out, to be honest. I didn't do much. I stopped exercising for almost a month. Again, this was all because if I'm getting this done,
Right. Yeah,
once in a
usually
while.
we recommend at least 10 days of no workouts,
Yeah.
post which usually at least the cardio activities and all is resumed. But yeah, almost a month's break is good enough for
I was a bit more cautious, but I think I took it easy for that 6-7 days that I got the procedure.
Correct.
Yeah.
When did you actually start getting that confidence that, okay, the results are now showing up? How was those few months, those 4 to 8 months of the transition period? Because as we get the procedure, and of course, initially it's the very little growth that we see.
Yeah.
Then there's also shedding phase, which panics a lot of patients that, why all the hair is falling off. And then the regrowth side. So how was it for you during that period?
So that's a very good question. So it's a journey. It's an emotional journey.
Yes.
So once you get it done, you don't know what the result is, right? Till you perhaps cross the 6 months, 7 months stage.
That's right.
So you have to keep telling yourself, be patient, be patient. So there were times when I saw the hair and I was like, hang on, this is not looking good. Then there were times when I was like, oh, this is looking awesome. Obviously, I came here for the post-op consultation.
Right.
The doctor saw it. I was also doing my PRP session.
Yeah.
So I would say it was an emotional journey.
Yeah.
But after the 6-month mark, you start seeing the actual results.
Right.
And how good it was in terms of the way it was transplanted.
Yeah.
Now obviously I'm really happy. I've not got a haircut done, by the way.
Oh.
It's been 8 months and I always wanted to grow my hair long after the hair transplant.
Yeah.
So now they are coming out really well. What I've been told is it's been about 9 months for my frontal area and 8 months for my crown. I think another 4 to 6 months will require for it to have those.
Yes,
100%.
overall takes a year to see the complete enhancement and the density. But I think with 9 months, it looks pretty good.
I mean, you're a better judge of how it's looking.
No, you should be happy. I think that's more.
I'm happy. I'm really happy. And as I said, it's been an emotional journey,
Yeah.
but the outcome has been really good.
Yeah, that's good to see. Earlier, there was a time that people were not very open about informing about the aesthetic procedures that they do, but I think things are changing with time.
In fact, now if you go to the airport, you will see people
Yes.
with the post of cap
Correct,
on their
surgical
heads and everything.
caps. Yes,
And they're not shy about it.
exactly.
In fact, if you go to Turkey, I've heard
Yeah.
it's a common sight everywhere now.
Yes,
right?
yes. Yeah. In fact, you'll have like a flight full of
Exactly.
people coming on with their surgical caps.
I mean, obviously,
It's-
Turkey is supposed to be the hub
Yes.
worldwide.
Yeah.
But yeah, to be honest, for me, it's obviously the name and the clinic, but it's the doctor who does it,
Yeah.
right?
Right.
Even in the same service provider, the output could be slightly different
Yes.
depending on the doctors who are doing it. So as I said, for me, it was in that priority,
Right.
the location,
Yeah.
the name, and
Yes.
the doctor. Who
And I think who's doing it? Whom are you giving your scalp to?
Exactly.
Yeah. So you are satisfied from that perspective that all your sessions were done by qualified doctors. Yeah.
Exactly.
Yeah.
Because I had heard that in a few places, the person who does it is not a doctor, but they
Yeah.
are a different
Yeah.
level, which
Yeah.
I was not.
The technicians
comfortable
or
with.
yeah.
I was very sure that a qualified doctor has to do it. So
Actually, that's the trend because transplant, as you know, you've gone through the whole process. It's a very tedious and a time-taking procedure. And honestly, when the doctors have to engage behind one patient for several days, several hours, it becomes a little difficult in a single clinic setup. So that's how the culture most places is globally. It's not only about Dubai.
Correct.
That surgeons are involved to an extent, but then major work then is executed by the technicians. And I've seen a lot of patients are now not very willing, with that approach. So when they come to us also, they do have this question, who's going to do the procedure? Is it start to finish a qualified doctor or is he going to be just partially involved?
Correct.
And I think, that is also something very important if somebody is researching, and considering to do a transplant.
In fact, I was a bit of a problematic customer for you guys in the sense that I had done so much research.
Yeah.
I had questions like, okay, for me, the quality of your frontal hairline makes or breaks it, right? If that doesn't come out natural, that's it. Because in the crown, in the area behind the hairline,
It's not so visible.
It's not so visible, right? So
Yeah.
I had multiple questions and therefore I needed a qualified, experienced doctor, right? And I got the right answers back, right? So that was my...
In fact, we are happy when somebody comes research because then they already have a lot of knowledge. It becomes easier to actually convey what exactly is a good quality transplant because you've already done your research and you're very clear into what are your expectations. So, in fact, we're very glad when somebody comes researched. The conversation gets a little more detailed and, they take mindful decisions as well.
And what I loved about Ashore was there were times when I was saying, no, I think we should do it this way. And the doctor was patient. Okay, fine. I know what I'm doing.
Yeah.
Good that you've researched yourself, but you're in safe hands. So I think it's also the quality of the interaction.
Yes.
How do you treat a patient with patience, with love, with care, with empathy? Because there are a lot of doctors or technicians who might lose their cool.
Yes.
But it was all very good here.
Yeah, and that's so important because when you're in that healing phase and obviously when you have somebody who's really calm and patient with you, I think that makes a lot of difference in the overall recovery phase as well.
Yes.
Right. So now that it's grown over 9 months, what is that? What is the difference that you feel maybe when you get up in the morning every day, when you see in the mirror? Of course, like you said, you were always confident even when you were going through the hair loss since you used to keep it shaved. But I think to an extent, hair, everybody would love to have once they grow. So what do you want to say on your post, transplant once the growth and everything came in? How were you feeling?
No, it's a massive change. First of all, it was the right decision, and I would recommend everyone who wants to get a hair transplant done to get it done, and hopefully with a show. Personally, for me, the best is I can style my hair very differently, right? And earlier I was hesitant in keeping my hair back.
Yeah.
Because obviously my forehead was big, my temples had started balding. Now I can style them, I can grow them, cut them in any which way. So I think that's the fun aspect that I was missing, which has come back. That's pretty much it. It's I can have different looks every day.
Yeah.
And also it brings a level of confidence, definitely.
Yes.
Right? Although I'm married and, my wife will love me any which ways.
Yes.
But it's good for her also to see a full mop of hair after so long. So yeah, I think overall it's been great.
How about professionally? Did you feel any difference in the professional life after the hair restoration?
I'll be very honest, no. Although I do get more compliments at times,
Right.
About my age, about me not looking my age. So perhaps that's because of the fact that I have a full mop of hair.
Right.
I didn't get those compliments before. So yeah, that's what perhaps has changed on the work front. But
Right.
yeah, otherwise.
Great. So what's one message for the viewers who are listening to you, because you've already experienced this procedure and there are a lot of people who are still a little hesitant or, not able to take the right decision, or maybe they're in the research phase now. What is the message that you want to give to the listeners?
See, my biggest message is be confident of yourself. Don't become sad, depressed because you don't have hair. That's my first. That doesn't mean that you don't look for options for a hair transplant.
Right.
It's a life-changing experience. It brings your confidence back. It gives you that, lost swag that you had earlier. But do your research. Take your time. There is no rush. Obviously, pricing plays a big role. Don't go beyond your means. But I would say research is the most important part. Choose the right service provider. And if you have any recommendations, I would rather, advise people to go with someone who's got it done before somewhere.
Right.
Rather than going in blind. So there were 4-5 messages there, but I think that's the overall.
No, but that's going to be very helpful. And, people who are in the research process, I think listening to you will get that confidence and understanding of this whole thing. So that was a great conversation. And thank you so much that you spared time and you're here with us on this platform. And it's going to be helpful to all the listeners who are, seeking for a hair restoration.
No, pleasure was all mine. Thank you so much.
Thank you so much, sir. Thank you for being here with us. Thanks.